Welcome to the EADV podcast. In today's episode, Dr. Christian Posch, Head of Dermatology at the Vienna Healthcare Group, and Professor Olivier Gaide, Head of the Center of Excellence for Skin Cancer at the Lausanne University Hospital, are thrilled to present the Journal of Dermatology and Venereology December special issue on digital intelligence for dermatology. But before we get into it,
EADV offers a whole program of courses with theoretical and practical training covering a range of topics in beautiful locations across Europe. Find out more at EADV.org and subscribe to our mailing list if you would like to be the first to receive updates on when course applications open.
The special issue on digital intelligence for dermatology has received over 90 high-quality submissions, confirming the growing interest in the topic and its promise for personalized medicine. Tune in now and embrace the change.
A very warm welcome to everybody. Welcome to the EADV podcast. My name is Christian Posch. I'm the head of dermatology of the Vienna Healthcare Group, and I'm joined here by
Professor Olivier Gaide. I'm the head of the Center of Excellence for Skin Cancer of the Lausanne University Hospital.
And you chose right to listen into this podcast today because we have something really exciting to share with you. We have just planned and put together a very exciting special issue of the JEADV, the official journal of the European Academy of Dermatology and Venereology. And this special issue is about artificial intelligence. And so, Olivier, thank you for joining and for having this discussion. Why did we or the journal decide to have a special issue in the first place, and why did we pick artificial intelligence?
Well, special issues are very useful when you have a large field which is exploding and you have a lot of data, a lot of new studies coming. And instead of trying and having, one study presented in each official, issue of the journal, then you group them together because they suddenly become they make more sense when they're presented one side by side with other great studies in the same field. So I think that's the role of the special issue is to bring all these papers together because they really make sense as a whole. And why artificial intelligence? That's because it's such an exciting field at the moment for dermatologists and actually, all the physicians in the world. I mean, if you don't live in a cave, you are bombarded with information in every newspaper about the new feature of ChatGPT 4 or 5 or 6 or 7. By the time we publish, maybe it will be GPT 6. I don't know, probably not. But what I'm saying is that the field is moving very rapidly, and we thought that the time was ripe because there were significant progresses that were being made. And this was getting much more than just, for example, skin cancer detection. So we thought this was the right moment to highlight this very exciting field and how it's changing dermatology and venereology.
Excellent. Yeah, that's exactly how I see it too. I want to bounce a question back to you right away. So if we're talking about a field that is rapidly moving, like artificial intelligence and all the applications that, as you said, are thrown at us, isn't there a risk that a special issue is already outdated as soon as we publish it?
Oh, well, it's science. Science is outdated basically on the day it's published. But it doesn't mean that it's still very useful because it really paints a great image of where the field is at the moment. And also, I think that some people, sometimes they don't realize the limitations and the benefits that AI brings to the field. And I think that everybody will enjoy tremendously reading this special issue. There's bound to be a paper for every dermatologist in Europe that will attract their attention because there are articles on very different fields: education, inflammatory diseases, skin cancer detection, patients' perspective about artificial intelligence. So it's a very special issue.
Yeah, I fully agree. It's really covering a broad spectrum of different topics, right? It's moving away from just sole differentiation between nevus and melanoma. That's an old one, right? And it's crazy how good that gets already. But there are so many other applications.
Exactly, and one of the thing which I think you were excited about, but you have to tell us more. And it is my time to ask a question. Is I think we had a great number of submission, much higher than what we usually get for a special issue. But you've been here in the journal for longer than I am, so you have a better perspective on that.
Yes, it was really outstanding. So we had a call. That's usually what happens for these special issues. So we announce a call for submissions to a special issue. And we received the outstanding number of 91 articles. So that's just crazy. Plus, the quality of these articles was incredible. We had a really, really hard time deciding which articles we should choose, which are most interesting, to also have a good mix. You mentioned it already, a mix of different topics, of different subjects, of different applications of how digital intelligence, you could say, is being used in dermatology and maybe also might be used in the future. And so we had to decide on a number of articles that are being included in the special issue that is going to be available in December 2024. But of course, there were more articles that we didn't want to throw out or reject, that are going to be included in other issues of the journal. So they are not part of this special issue, but yet part of the JEADV, and we're very thankful and very happy for this outstanding number of high-quality manuscripts. I think it really speaks to the topic and the interest of people to try to advance the field, and I think that's exactly what we anticipated, but still we're kind of surprised and happily surprised how well it was received. So I think that's a success story in itself.
Yeah, this was my first special issue, and I must say it was difficult to have to pick some papers and say, well, these ones are going to be for a later edition, and it was very hard because those were very good papers.
Olivier, I think we should at this point, and we're already late with this, have a big shout out for Philipp Chandel. He was a guest editor on this special issue, and he did a tremendous job. He had great reviews. He attracted fantastic papers.
He attracted fantastic papers. Contacted a lot of great people in the field.
Yes, and he also wrote a little piece for this special issue, which we were very, very happy and thankful for. And I hope we can maybe at some point have him back as a guest editor. It was really fun.
Yes.
So if we go into the topics that are going to be included in the December issue, and we encourage everybody to really have a look at it and read it, what stands out to you? What do you think is something that is going to have a lot of traction?
Well, I'd already hinted that there was a broad list of subjects that we could include. And of course, since the paper in Nature by Estevan et al., we all know that you can use artificial intelligence for cancer detection. And usually people think, okay, that's what AI stands for in the field of dermatology. But here we show, there's indeed the field of dermato-oncology, but there's also artificial intelligence for education, for inflammatory skin diseases. We have great papers on vulvar lichen sclerosis, on lupus detection, and on atopic dermatitis, for example. And those were facets that were maybe not put to their advantage or not set as highlights before this special edition. There's also a very interesting paper on skin aging. So, it covers a very broad range of application of artificial intelligence that will interest all of our readers. I'm quite certain.
Absolutely, yeah. And we also have topics that are using large language models like ChatGPT, for example, and surrogates of that. And it is really interesting to see how that is changing not only education, but also how we get information. And I just recently read a paper. It was a preprint though, so it hasn't been peer reviewed yet, but I'm sure it's going to get published. They tested something that was really striking to me. They compared two groups. One group of doctors was just making decisions on clinical cases, and the other group got support by ChatGPT. And interestingly, both groups did pretty much equally well. Then they had a third group, and that's the striking one, where they just asked ChatGPT to provide an answer or a guideline what to do next. And shockingly, ChatGPT was much better than the physician alone or a augmented physician with ChatGPT. So that raises a lot of questions for me. What do you think about that?
Well, that raises a lot of questions indeed. I haven't read the paper you mentioned, because some of the articles we show here show rather the opposite, that it's the augmented intelligence, which is better than both the single doctor and the artificial intelligence.
So it's human and machine, right?
Absolutely. We also have an article. I mean, we have articles that show that if you trust reviews that are just made by these type of softwares, they're just not good enough. You know, that they may include some information that is utterly wrong, and so you need some supervision. You need some checks, and I think that this is where we still need good doctors. We still need to be well trained in order to have this capacity to do some critical reading and say, well, all of this seems perfect, but this piece of information, I'm going to check this on PubMed the old way, or I'm going to ask ChatGPT again, because this is really what we have to learn, and it's be critical about an answer that is given by one of these softwares, and just prompt it to say, are you sure about that part? And then usually the answer is corrected. And that's one of the things So that's one of the things which I think it will be very interesting in the future.
Absolutely. And the only way how we can stay and be critical is to gather knowledge, to learn, to understand, and to consume information, right? And put it into context and perspective. And we must not lose that capability, because otherwise we just have to believe what these machines are going to throw at us, right?
Exactly. If you just believe them blindly, that there's a small risk that, or there's a big risk. It's still hard to exactly know, but there's certainly always a small risk that some of the information you're using is completely wrong. So that's one of the key aspects that we'll have to make sure that we understand and that we move forward on this and act on this.
So what I would like to ask you, I mean, we have the token melanoma versus nevus manuscript in there too. And that was one of the first ones that was able to show that machines can actually be really useful. But that's kind of an old story already, right? Even though these systems are improving tremendously. What do you think, what are the subject areas of dermatology that are going to experience the most change in terms of augmented dermatology?
Well, I think that you have to always look at the bigger picture. What we ask dermatologists to do is rarely to look at a picture and decide whether this is malignant or not. What we do is much more than this. We see a patient, we analyze all the images of the entire skin surface. We look at several moles, we do several suspect lesions, and then we decide which one we want to excise. But we also explain to the patient why and what we're going to do, and then we do the excision. So, it's really from the patient to the excision, which is important. And here the physician still plays an important role. But for example, in the field of teledermatology, you can have pre-reading of all the images that you receive. And here you can win a lot of time if you have a software that presents you some of the images and say, look, you've received 200 emails, but in these 100 emails of images, I think this one is a melanoma. Then you can triage much better. Yeah. Triaging is one of the the field of where AI can be extremely useful and can really relieve us from some of the strain of the sheer number of patients that we have to see nowadays. Think about the histopathologist. Again, if you have instead of looking at all the slides and checking that your BCC is excited on all the slides, if you can have a software that tells you, oh, well, actually on slide 255B, this is where you're at the limit, or your incision point is within the tumor, and you can just go and check this image, you can win a lot of time. So I think augmented intelligence will, and this again is a form of triage, will allow us to be much more efficient. And my hope is that this will allow us to have more time with our patient, less time behind the computer and more time with our patient. And this is one very important aspect. In all the fields where the physician is not with the patient, this artificial intelligence will relieve us from some of the burden of the brunt of the performance that we need to do and in order to diagnose patients. And then there is the fact that the data that we need to process is becoming higher and higher and higher. The granularity of the decision we make is made of more and more and more aspects. I see this very well in the field of oncology, where you can subclassify patients according to more and more criteria. And this allows you to do, really, really personalized medicine. But it's going to be the same in the field of inflammation. If you look at the paper we have in this special issue about lupus diagnosis, and you think about the fact that the criterion for lupus are getting more and more complex. If your software can do this job for you and you don't have to punch all the numbers, but right away from your conversation or from your patient file can tell you your patient classifies for lupus diagnosis, you win a lot of time, and I think you'll be a better doctor. That's very exciting.
Yeah, I agree with you. So we have a few aspects that are might hit the clinic in shorter periods of time, and there are some that are still in the distant future, right? And we do have aspects of explainability and sometimes even problems with explainability, like how does the machine come to the conclusion that it comes to? And that is still to some degree, unsolved problem. But that's something that is also getting better, and it will also help us to understand diseases better. And there's some things that machines can do that we just can't. We can't process genomic data to the degree that a machine can. And the same is true for big data sets. And we might even be able to find new groups of patients that are, when you're talking about personalized medicine, right? I think it's more precision medicine than personalized, because it's still groups of patients. But we can, for the first time, maybe group them according to certain patterns that are hard to recognize for a human, but might be evident in large data sets to a smart system, that being an artificial intelligence. And so I do agree with you that the multi-layered approach, where we have different qualities of data points, from numbers to text to video to scans to images, can all be integrated in the future and put together, and actually are going to help us to form a bigger picture of our patients. It's something that we all strive for, right? Yes, really. I mean, and this is not only really, again, this is not only just skin cancer detection. This goes far beyond this. And I think that, again, if you ask on your everyday practice to think about the 257 risk factors that are pertinent for your patient, it's too much. You cannot process this, so you need some help to. And again, this lightens to the burden of your work. So I think this is very exciting. Yeah, I fully agree. So with that, I think we have done enough teasing. Now it's time to wait for December and have this special issue published. And we can only urge everybody to pick this issue up, have a look at it. As Olivier said, there are going to be aspects and articles in it that are going to be of interest to anyone. If you want to learn about more futuristic outlooks in the dermatology future, like digital twins, artificial digital twins in dermatology, for example, we have an article in there. And we have histopathology in there. We have inflammatory skin diseases, and so on and so forth. So please have a look. You will be excited. We were already excited by the high quality and fantastic articles that we were able to include in this manuscript, in this journal. And with that, I think we can just say, have fun with the issue, right?
Yes, and if you read this issue, and you should absolutely do it, you will probably, you will not fear AI anymore. I think you will embrace it.
Excellent.
That's my take-home message.
This is a fantastic end statement. And with that, Olivier, thank you for your time. And yeah, we'll see you next time here at the EADV podcast, and have a great day and fun with the special issue.
Thank you, Christian.
We would like to give a special thank you to all our listeners. If you haven't already, make sure you subscribe on Apple Podcasts, follow us on Spotify, or otherwise find us on any major podcast provider. We appreciate you joining us and look forward to presenting more interviews, research, and other topics of merit. Until the next episode, take care of your skin.